to attempt to do this in one take. We'll see how it goes. Um, so today I'm going to talk about the anatomy of the heart since we are in the cardiovascular unit. So I wanted to make sure you guys understood the parts of the heart and how blood flows through the heart, etc., etc. So um, the cardiovascular system is a closed system consistent of the heart and the blood vessels, unlike an open system that, opens up to the environment or the outside world. In this case, this is a closed system. The heart pumps blood, and then the blood vessels allow blood to circulate to all parts of the body. Um, the function of this system is to deliver oxygen and nutrients and to remove carbon dioxide and other waste products, and to overall maintain pressure within the cardiovascular system so that you have blood supply in places that are a little bit further away from the heart. So let's go ahead and take a look here. This is the cardiovascular system in a nutshell. We have two circuits. The first circuit pumps blood from the heart to the lungs, and that's called the pulmonary circuit. And then there is the systemic circuit, which pumps the blood to the cells of the body to make sure that they have oxygen um, and they are well supplied, we'll say. Okay, so the location of the heart is not on one side of the chest. When people do the Pledge of Allegiance, they put their right hand over their left chest, thinking that the heart is um, over there entirely, but that's not true. The heart is in the thoracic region between the lungs, and because the base and the apex are a little bit towards the left side, I think that's where the misconception comes from. So the pointed apex is directed towards the left hip. Here it is. It's this pointed region. And the base is between the second or beneath the second rib. So about here. And the apex is specifically located between the fifth intercostal space. The size of the heart, if you're a grown adult, is the size of two fists put together, and it's less than 1 pound. And so we're going to go through the coverings of the heart. So the outer layer is this double serous membrane. It's called the pericardium. And the pericardium is consisted of two subpericardiums, we'll say, an outer, more tough, fibrous layer that's made of dense connective tissue. It's called the fibrous pericardium. And it helps the heart anchoring to the body so that when you're jumping and stuff, the heart doesn't bounce all over the place. And the serous pericardium is more of a visceral pericardium, so visceral tissue like surrounds organs, so it's directly next to the heart. And between those is the serous fluid that fills the space. And then we have the parietal pericardium, which is the outside layer, and that's made of dense connective tissue. It's attached to the central part of the diaphragm. It's posterior to the sternum, the vertebral column, and the large blood vessels of the heart. So let's go ahead and look at this. So the pericardium is this outer layer. And if we were going to zoom in, we have the fibrous pericardium, which is more external. Then we have the parietal layer of the serous pericardium and the visceral layer of the serous pericardium. And then there's the cavity in between that has that fluid. It has pericardial fluid. And then you have the wall of the heart, which is 3 separate layers. So the wall is made up of the epicardium, the myocardium, and the endocardium. So the epicardium is the outside layer, Myo means middle, so myocardium is going to be the middle layer, and it's mostly made of cardiac muscle, which does all the contracting for the heart. And then the endocardium is going to be the inner layer that's made of squamous epithelial tissue. Little throwback to histology. So let's go ahead and take a look at this. So on the outside is going to be the pericardium that we talked about, and then it goes epi, myo, endo. Okay? Right. So some external heart anatomy that we need to know. There's obviously more parts here than we're gonna go over. So starting from the right side, which is going to be this side, because you're always looking at your patient from anatomical position. So we have the superior and the inferior vena cava, and that takes the blood in, and the blood flows into the right atrium, which then flows to the right ventricle. Then it flows out the pulmonary trunk through the pulmonary arteries. So the pulmonary arteries then lead to the lungs. The lungs oxygenate the blood, brings it back through the left and right pulmonary veins, which are here and here. And that brings it through the left atrium, down through the left ventricle, and then out the aorta, where it gets pumped to the rest of the body. So, I think I forgot to highlight one of these. There we go. So there is another part that you might not be familiar with. It's the auricle. It's these like flaps here. Go ahead and clear those in. And that helps collect oxygen-rich blood and moves it to the left ventricle or the right ventricle, depending on which auricle it is. So those are just resting like kind of on the outside of the heart, and those parts help with just aiding in getting that blood into the ventricles. Okay, so just to review, here is the circuit that I explained. So the body has oxygen poor, carbon dioxide rich blood. It flows into either the superior or the inferior vena cava, which flows into the right atrium, which is like the first, we call that the room. And then it goes through to the right ventricle, then out the pulmonary trunk and the pulmonary arteries to the lungs, back through the pulmonary veins, through the left atrium, left ventricle, and out. Now, the red and the blue colors are just an artist's depiction of oxygen-rich and oxygen-poor blood. When you actually look at a person and their blood, the blood, if it's like a little bit darker or lighter red, that just means does it have more oxygen or less oxygen in the blood? The blood is never blue. So I want to put that stereotype to rest right away. Okay, so the left and right chambers, the right and left side of the heart act as different pumps. And there's 4 chambers, and they're separated by the septum. So I'm going to go ahead and fill in the septum. It's right here. Okay, so that the blood doesn't like mix. The oxygen rich and oxygen poor blood doesn't mix. So we have the atriums, like I said. So the atria is plural, and those are the receiving chambers. The right atrium receives from the body, so right here. The left atrium receives from the lungs. The ventricles are considered the discharging chambers, so they discharge either to the lungs or the body, depending on which one it is. And usually we kind of designate that arteries versus veins, like what the difference is. So arteries usually lead away from the heart, and veins are towards, the blood is coming towards the heart. Okay. All right, so the valves of the heart are what make that lub dub sound. The lub part is the tricuspid and the mitral valves closing, which I'll show you what those are. And the dub part of the lub dub is the aortic and pulmonary valves closing. So that's where that sound comes from. Just wanted you guys to know that because I know you would find that fascinating. So the valves of the heart allow blood to flow in only one direction. Okay, I'm sorry. That's my One Direction joke for the day. Okay. So there's four valves. So they're classified into two types, the atrioventricular valves or the semilunar valves, depending on what purpose they serve. So the atrioventricular valves are between the atria and the ventricles. So I went ahead and circled those in this dark blue color. So the tricuspid valve is, see if I can match that right here. And the mitral valve or bicuspid valve is here, and they separate between the atrium and the ventricles. That's why they're called atrioventricular valves. And so actually the mitral valve is named after what a bishop wears on his head, this like giant like special hat called a mitre. And it looks kind of like a bicuspid valve, so I think that's where they got the name from. And the tricuspid valve has like three almost flaps. Let's see if I can show you down here. So this is what the tricuspid valve looks like versus the bicuspid. So as you can see, like the flaps, there's three for tricuspid and two for bicuspid. Okay. Semilunar valves, those are between the ventricle and the arteries. So see if I can, there's only one in this picture, the aortic valve. I couldn't find the pulmonary semilunar valve at all in this picture. So I think it's down here. So the aortic valve between the ventricle and the artery, and the pulmonary valve there. Okay. All right. So here's a little summary in a table of the four types of valves. Two are the atrioventricular and two are semilunar, and their location and their function. Okay. So the valves are designed to be so that so like your blood will only flow in one direction, like I said earlier. So the valves open as blood is being pumped through, and they're held in place by these things called heartstrings or the chordae tendineae. Here are they. Let's see if I can find them. Here are the heartstrings. You literally do have heartstrings. So when someone says, "Oh, you're pulling on my heartstrings, I don't want to give you, what you want." Well, here they are. So here you can see it in the picture. So the valves are held in place by these heartstrings and they close to prevent backflow. So it's basically just a one-way door. So if we were going to classify this as like a structure or cardiac, it's called cardiac skeleton. Cardiac skeleton has four bands of collagen that wrap around the bases of the pulmonary trunk, which is this thing. I'm running out of colors here. Pulmonary, let me find a new one. Pulmonary trunk is this thing. Okay. The aorta and the heart valves. And while it's not a true skeleton per se, it does provide structure and support for the heart, as well as isolating the atria from the ventricles. Okay, let's see if I can get that for you. Okay, so the cardiac skeleton is like these things. and they help just structure and support because your heart is pumping for your entire life. So you got to have some type of support and structure for the heart, like at least isolating like all the different chambers. So that's why we call it cardiac skeleton. All right. So basically, your valves are super important to making sure that the blood flows in the proper direction at the proper time. So if you have this thing called an incompetent valve, it leads to backflow and like a almost like a repump, and some people they might need a pacemaker or some type of device to kind of control the valves. So if you have this thing called stenosis, it's like considered like stiffness, and your heart workload is going to be increased. And so your valves can be replaced. You could have a maybe it's just like a rhythm problem. You can get a pacemaker, and so here is how the atrioventricular valves work and the semilunar valves work. So the blood returning to the heart fills the atria, putting pressure on the valves. Then the valves are forced to open, just like a door. As the ventricles fill down below, down here, the atrioventricular valve flaps hang limply into the ventricles, and then when the atria contracts, the blood is flowing into the ventricle. And then when the ventricles contract, so the lower rooms, we call them, then the atrioventricular valve shuts. And then the chordae tendineae, they tighten, and that's that. On the other hand, the semilunar valves, when the ventricles contract and the pressure rises, the blood is rushed up, forcing them open. And then as the ventricles relax and the pressure falls, the blood flows back, and then it's already closed here, so it can't flow back per se. It can't do this thing called the backflow. All right. So some of the major blood vessels, we have the aorta, which like once that's ruptured, you're kind of done for. That's leaving the left ventricle, and it's so huge because it's the major blood vessel that all your oxygenated blood is going, flowing out to all of your arteries throughout your whole body. So it has to be very massive. And so we'll have like a common carotid artery, and some of those arteries that you might be familiar with are attached to the aorta. So both the pulmonary arteries, they leave the right ventricle. So those are blue because it's technically deoxygenated blood, so it's going to go to the lungs. It's not actually blue, but just artistically, it helps us remember, what is considered oxygenated and deoxygenated blood. The vena cavas, superior and inferior, they're entering the right atrium. They're carrying deoxygenated blood from the body through the veins, and there are pulmonary veins, which enter the left atrium, that carries oxygenated blood from the lungs, and there are 4 of them, so they enter the left atrium. Now, the pulmonary vein and arteries so typically we think arteries are leaving the heart, right? And they're flowing from the heart to the body, and they're typically artistically considered red because they have oxygenated blood. The exceptions are the pulmonary arteries and veins. They are kind of flipped with oxygenated and deoxygenated blood, so that confuses some students. So just gotta be aware of that. All right.